Good afternoon. I am really honored to be here. I mean that very sincerely. This is a very august, learned, and accomplished group of people to be associated with, and I'm so thankful that this event is being put together and we're really seriously looking at the issues of elder abuse and neglect and exploitation. And somebody was remarking to me, if you just look at the research from 2009 on, it's just blossoming. So, and we hope this will keep that snowball going down the road. Thank you, Carmel, for demonstrating an evidence-based basis for saying that APS interventions do work, at least in those self-neglect cases. We need a lot more of that kind of research. I was asked to talk about the APS workforce, and NAPSA, which is the national organization, Sid mentioned this, representing APS, of course, and APS clients, we are very lucky and grateful to be administering the first National APS Resource Center. And I'm going to talk about a survey that we did through that resource center. It's going to be the basis of the information I'm going to tell you. We went out to all APS, state APS programs last year and asked them every conceivable question about how their program worked, not about the reports they got in, which was earlier work in 2000, 2004, very important, should also be repeated. This was, where are you located? How much training do you provide? What are your requirements to hire people? Do you have multidisciplinary teams? So I thought the most useful thing to do might be say, where is APS now? And then look at some of the challenges that we are facing. I am not going to read these definitions. I'm sure you're relieved to hear that. I do think that it's important that we do now have federal definitions of these terms we're talking about in the Elder Justice Act of neglect, and really important for APS because, as you've already heard, self-neglect is a huge part of APS work. Self-neglect is included in those federal definitions. APS is also defined. So you all, I think, in this room know what Adult Protective Services is. It's created under state statutes, authorized under state law in every state. It's in every community in the country. And its purpose is to receive reports of abuse, neglect, and exploitation of older people and adults with severe disabilities, investigate those reports, and then do something to make the situation better, protect that client, put services in place, and somehow in all this you have to figure out whether that client has the capacity to accept those services, to not accept those services. And that's, of course, the trickiest, as has been mentioned by many other speakers, the trickiest part of all this work. The important thing to know, if you don't work a lot with APS, is APS does not equal APS. Because up until now, there has really, up until this administration, frankly, and Kathy's leadership and other people's growing interest and concern about this, there's been virtually no federal leadership, no federal support, no federal sort of locus, there's no federal office of APS. And as a result of that, every state has developed its own system. Now, by and large, they do the same things I just mentioned. They receive reports, they investigate reports, they go out and try to help the victims. But they can differ in many ways. Definitions of who's an eligible client, what are the types of abuse, what are the age requirements, is there a disability requirement, is there a residence requirement for the clients, does the abuser have to be in a trusting relationship? That is true in a couple states. Whether they require mandated reporting, and if they do, who's mandated. In a surprising number of states, all persons are mandated to report. I'm not sure how that's enforced. I don't think very successfully, but then mandated reporting in general, as we all know, isn't very successfully enforced. But in my mind, there's a lot of controversy about it, of course, because we're talking about adults. My mind, the value of mandatory reporting has always been that it gives you an entree to train healthcare providers. It gives you an entree to train law enforcement. It gives you an entree to train the people that come into contact with older people about this issue. And of course, there's enormous differences in resources. This is a chart from the survey, and I don't know how well you can read that, but the big blue part of the pie chart, it represents 38 states, which represent the default model of APS. And that is that they serve all adults 18 and above who have a significant disability, however it's defined in their state laws. So that becomes important. For example, if you're talking about reporting, like Wells Fargo has a national policy to report all elder abuse to APS. Well, in 38 states, unless that older person has some sort of disability and can be defined as vulnerable under that state statute, APS cannot go out and intervene in that financial exploitation case. Now, of course, many financial exploitation people are, do have dementia, are vulnerable in many ways, but that is an important distinction. A couple states have 2 programs, one for older people, one for people 18 to 59. Now, there are some states that will serve anybody over age 60, and some of them also serve 18 to 59 with disability, but then when you get to 60, or in California it's 65, I think in Texas it's 65, they can serve anybody regardless of disability. So if you that age and you're financially exploited or otherwise mistreated, APS can in fact go out and help you. So there's lots and lots of distinctions. This is just some case examples of how this might make a difference. In state 1, if you're 60 or 65 years old, you're eligible for APS services. But if you're financially exploited, it has to be by somebody in a position of trust. And the program only does investigations in the client's home, in the community. And by the way, 100% of APS programs investigate abuse, neglect, and exploitation in the community. And about 50% investigate in facilities, and not just long-term care facilities as we think of them in the aging population, but also mental health facilities, facilities for the developmentally disabled, group homes, that sort of thing. So in state 2, the person can be any age, but they have to have that vulnerability. Financial abuse can be by anybody, and they investigate in both community and institutions. So it's sort of hard to get your head around all this sometimes. Yeah. NAPSA has promulgated an APS Code of Ethics, and I think most state programs have the same kind of code. Adults do have the right to be safe, but they also retain all their civil and constitutional rights. And as I think I heard Laura Mosqueda say one day, we're Americans, damn it, we can do whatever we want to do. And that's our basis of our system, that you're an individual and you can make your own decisions as long as you're not hurting somebody else. But then we get back to that thorny question of when do you lose that capacity, and all this new brain research. I don't know about you all, but it's scaring me half to death, that you may think you're fine and you may think your parents are fine or whomever, and it turns out really they shouldn't be writing the checks or making the investments, and it's really going to be a really tough issue to tackle. But I think if APS needs a lot of help, in many ways, which I'll get to later, but certainly improving our ability to screen for capacity issues in a credible way that is scientifically based and that is easy to administer and not expensive is really way up there. And of course, one of the reasons people get disgusted with APS is that clients can refuse our services, and we can't force them. We can't say the government's here to help you and we're going to help you whether you want it or not, unless they lack capacity, and then we do involuntary services and you bring the courts in and all that kind of thing. So finally, I'm going to talk about neglect. Specifically, it is the most frequent type of case that is reported to APS. In the survey we did, it was 36% of cases. Many of those, of all the neglect cases, about 60% were self-neglect. Now, I say 2 contradictory things here. Neglect is the most underreported of all types of elder abuse. That's based on Dr. Lack's work that said that only 1 in 57 cases of neglect was ever called into any helping agency in the New York State study. But in terms of APS, it's the most reported, so I should have worded that a little better. And of course, many victims are, by definition, unable to report. This has already been brought up by other people, but abusers, we call them abusers, even if they don't even have the capacity to form intent. They may, in fact, be after the victim's money. They may be criminals who should be prosecuted. And a lot of the neglect that takes place, I think, and this is based on my personal experience in being the APS administrator in Illinois, is that a lot of the neglect cases, the neglect by others, and a lot of the physical abuse cases, and a lot of the emotional abuse cases are motivated by greed. I mean, people want that money, and they exert those forms of power and control to get at the older person's resources. But we have many, many, many cases, which has already been mentioned, where people are simply incompetent to provide care, unable to provide care. I like to give the example of the 100-pound, 80-year-old woman with osteoporosis who's trying to transfer her 175-pound husband who's had a stroke. She doesn't want to be separated from him. She wants to care for him. She's doing her best. She cannot provide the care that he needs. And, you know, then we have the typical batterers. And by the way, when you talk about domestic violence, that's another example where in most states, a healthy older woman in a violent situation who does not meet that state's definition of vulnerability will not be an APS case. And having come out of the domestic violence world many decades ago, as I tell people all the time, I'm always in issues before they have any serious money. So people are waiting for my retirement because then elder abuse will take off. That really, this is my personal opinion, the domestic violence system has a long way to go to really step up to address this issue of this, you know, huge wave of older people and older victims. They can do a lot more than they have traditionally done. So where is APS? This is another reason why APS is hard to categorize. 33 programs are totally state administered, so the person going out knocking on the door is a state employee. 8 states, it's county administered, but I'll show you in a minute. There are some of our larger states, and then there's several other kinds of arrangements: prosecutors' offices, private not-for-profit, aging network providers, and so on. The county administered states, as you can see, are California, obviously huge, and it, by the way, has the distinction of being the only state in the union which has no one at the state level in state government to do anything with APS. You cannot find somebody to talk to. That was the only state we had to badger to get our time, 2 minutes. Only state we had to badger to get our data. And we did have 100% response, by the way, on that survey. We're very proud. So where is APS located? About half are in state units on aging. The other half are in departments of human services, or they're independent. However, the state units on aging, by and large, are in departments of human services. So actually 41 states are in DHS. Just a little bit on training. We go from none to up to 6 weeks, more than 6 weeks. And 19 states have up to 1 week or 1 week's training before people go out. And as you can see, several states provide none. That's what's included in the training. This is shocking to me, that 42 states provide some training for APS supervisors, and anybody who's worked in this field knows that supervisor involvement is absolutely critical. I mean, you cannot do this work well without supervisor involvement and knowledge. And so 42 states do some training, but of those 42, 20 provide nothing about APS specifically. So they tell them about their agency's personnel policies or something like that. And 10 states provide absolutely no training to supervisors. Contrary to what a lot of people think, the majority of APS programs do participate in multidisciplinary teams, and they almost always include law enforcement, healthcare, criminal justice courts, that kind of thing. 43 states have at least some. Okay, what are our challenges? We have more and more cases. They're more and more complex. Multiple types of abuse, multiple abusers. As we increase awareness more and more, of course, we're going to get more reports. There's very little funding. There's no designated funding federally, of course, but in 48 states in the previous 5 years when we did the survey had reduced their staffs and 87% had had increases in the number of reports and caseloads. We're worried about SSBG, which is the only federal funding that trickles down to states. It's used by the majority of states to support APS. And these are the challenges that states themselves reported: adequate funding and staffing, of course, the most serious issues, decreased support for training, real big concern about the dearth of community services. As community services are cut back, of course, it means APS can't help those people stay safely in the community as well. We really need data collection, and a lot of people were frustrated by not enough prosecutions. So we're doing what we can. We're doing a couple of things under the National Resource Center. We're trying to learn how APS programs, which have had their budget cuts, are coping with that, what they're doing, the strategies they're implementing so they can help others. We're looking for evidence-based practices in other fields that may apply to APS. And we're also working on developing a national core competency training program, and we've developed a set of minimum standards, national standards for APS programs. We will continue to host the only national annual conference for the field, and we really hope to do some other stuff like national data system and caseload study and more research, et cetera. So in sum, APS needs resources. I mean, I don't know how else to say it. We really need to support this system in serious ways. And I think people need to understand. I think a lot of people don't understand APS. I don't think they really understand what we do and how we work and the difference we make in people's lives. We need more training, research, multidisciplinary work, public awareness. Thank you very much.